sculpting. And we have one of my good looking patients here today that wants more of that like masculine, more structured look. And he's real lean. So honestly, anything that you do can be really noticeable. So you have to be really careful about not overdoing it and making him looking natural, okay? That's the goal. And in some of the newer things that you guys are gonna be hearing coming out on our social, I'm talking about the futuristic way. Let go. There you go, hold it there. I'm from the top. Right there. There you go, lift up a little bit. In the future, how we want aesthetics to be, because I'll tell you guys, my opinion, where aesthetics has gone is a little crazy. Luckily this year, I think there's more people that are finally going towards that natural aesthetic look, but how are they getting that? They're doing regenerative injectables, hybrid injectables, and surgery, right? And so some of my patients do earlier surgeries if their bone structure isn't where we want it to be. And so, but we're creating a little bit of that bone structure now. Look at that. Even helps the neck with filler. Now, sometimes, and you guys will see in my new procedure, Maxoris, which is going to be the male, futuristic male, perfect aesthetic, let's call it that, optimized aesthetic. It's that structured look where the foundation is treated first. So we're all the way on bone when we do these treatments, okay? And that's giving him support, almost as if it's an implant, or if you had an implant on top of an implant, to give it structure. You guys see, look, we're creating that border. You see it's already almost there. Look, just a half a syringe and it's already improved. But in this optimization plan, or let's say our molecular coding, we are going to go layer by layer. So we're going to treat him on the bone, we're going to treat the tissue, and we're going to treat gravitational changes. So we're going to do threads, we're going to do filler, we're going to do regenerative injections like Renuva, adipose tissue matrix, which is going to help build long-term collagen production for him. He's doing real good. And I'm just outlining a little bit before we get to the chin. Again, tissue. And so sometimes what we'll do is we'll do a combination or a hybrid treatment where we use multiple different fillers at once. Sometimes HA combined with Radiesse or calcium hydroxylapatite. I've been doing this for so many years, and now actually pharmaceutical companies are starting to produce them, not in the US, but outside, even with Botox in them, honestly, for around the eyes, fine wrinkles. So you never know where the future is going, you guys, but that's why we're always going to be ahead. So we're doing that treatment today. So I will post today on my Recodex system, Instagram, and our IG what Maxoris is, because in some people it may mean implants. It may even mean an earlier neck lift. Like we're going to do threads here today, but if he wanted to, he could tie the muscle together and just bring it up like that and make it even more contoured if we wanted to at some point. Even awake in the office, which is pretty crazy. So we're building out that bone structure. And we're balancing. We want him to look natural. We want him to look healthy. So how do we do that? We have the long, oh, here it is. We blend. And so we're going to blend different areas of his face. Right now, we built out a little on the structure. Now we're going to come along his jawline, and then we're going to go to his chin. I'll show you guys. So this is going to give him, Daisy, a little blood. So we're going to line, turn left a little bit. There you go. We're going to line his, there we go, jawline, okay? Creating a little bit more of that structure and that shape so that he has that, more of that sculpting. Because he's super lean. I want his jaw to really pop. I always look a little bigger. I always tell people it looks a little bigger at first. And then, let's go the other way, needle. But look at it, you'll see once we balance everything, he's going to be our ideal male facial shape. It's going to be great. And he also, oh, Daisy, flip the candy. I've never seen it do like a swimmer's dive. It's like a diving board, spring. So now we're going to do different layers, okay? We're on the bone first. now in tissue. And I always tell people, always looks more this day. I feel like some guys like that and some get scared. But then a week later, they always want more. I'm like, oh, so you got scared before, now in the tissue, we're doing a hybrid blend of HA plus our radius. This allows the tissue, actually, I want to do cannula. This allows the tissue to improve and it be a softer look on the edge, which is much better because then otherwise it looks too bulky, which I don't want him to look bulky, just enhanced. Although I think he's gonna like this more sculpting a lot. What made you want to do the filler?
I really wanted a more, just kind of chiseled, more male defined
like
jawline, cheeks, and definitely with like the volume loss. Like I am thin, have a fast metabolism, so just want to really.
I'm jealous of that because you know I like fast food.
Me too.
Do you really? What do you eat? What's your favorite? I would have ordered it for you. I didn't know.
Oh, I know.
I know these guys over here. They always do this. McDonald's comes all the time, but I do that too. I just don't let them see it's at night.
DoorDash is a problem.
I know they make so much money off of you. And see, you know what's so funny? I'm going to tell you something hilarious about that. People will go, "Oh my God, you know the Botox, it's like $2 more," and then they'll go to DoorDash and spend $100 with $25 delivery.
Easy.
What? I'm like, what are you talking about? You're yelling at your dermatologist for $2 a unit, and then DoorDash just ripped you off for 20%? Are you out of your mind? Like, you guys, let's get our priorities. I guess the priorities are how they love the McDonald's. All right, let's go this way. But I like McDonald's too, so. Yeah, that looks great. So here's the thing. If you take a look, you don't want to get rid of this too much. You see how he has this sort of sculpting. But I still want him to have a lift in his neck. So we have to add some volume in between the muscle there and the chin. It's just going to look better if we do. I know it looks like it's painful, you guys, but it's not. And we're also doing a diluted form. Again, so this is going to create more collagen production here and sort of lift this area. In the old days, we used to call this a neck wash when we did it on the neck. It's almost like a jaw wash. This is what I call our Recodex procedure for men, which is basically going to be restructuring their face, optimizing what we can get them to be. Sometimes it might be with filler, and sometimes it might be with surgery. We don't know, or both. But it's whatever we need it to be. Okay? So, hold on, stay right there. We wipe that side real quick. All right, now we're going to go to the chin. So now, turn just a little bit more this way. So now this area right here, go ahead. This area right here tends to be an area that guys, people will build the jaw or the chin, but they won't address this lower cutaneous lip area. And what happens is when that goes down as you age, because the bone structure starts to fall. And that's why with my Recodex philosophy, you're going to be building bone structure over time, because we're going to be using regenerative injectables like this that build collagen as well in the skin as well as bone. We're going to fill this out because this is going to give him that little bit more of that structure he wants. And you'll be surprised at the difference that it actually makes. It's just going to feel really weird because there's a lot of numbing in here. Okay. And it's a weird injection angle because we're going more superficial. So your skin will feel it a little bit more. And we're building out a little bit more of that width, but also the layers. All right. Good. Okay. Now at the other side, we're going to switch. This ends up looking so good. It's a little bulkier today, but the end result is amazing. And this is basically our layered approach from Maxoris, you guys. So our optimized male facial anatomy in 2050. That's how I see it. He's going to look the same forever. That's the goal, to keep him looking good. He's got no sun damage either, so we'll keep it that way. You guys see we're doing that sort of blending our softer filler, and these particles that are in here, this is hybrid very soft HA plus calcium. Oh yeah, look at that. No, that's very good. One more to go. Try to this one a little more in the jaw. Go ahead. Go a little bit more down on here. Go ahead. And so again, you know, the goal is for stimulation of collagen as well as creating a new sort of structure, because these calcium spheres will tell his body to sort of thicken this area. Look at now how much is actually pulled up on his neck. Go ahead and give me the needle again one more time. But it'll feel a little heavier today because it's got some fluid in it. But this is that hybrid regenerative technique that we're going to be talking about, I think, in future. I think that's where people are going. Now, we've obviously been doing this a while, but I feel like the aesthetics industry is going to start doing that. They're starting it with the salmon sperm, or salmon enzyme, which has become popular here, but it's already very popular in Korea. Okay, perfect. So now we'll leave that there. Go ahead and switch side. Actually, I'm going to stay there on that side. Hold on, one more. So what questions do you think that they have, or what questions does he have? It's good, why not get him involved? Any questions right now, or no? Why did you want to do this sculpting with me?
Really social media. I think
What did you see?
I saw your focus on like the male facial sculpting versus female. So that was a big, you know,
Very
kind of
different.
point that I wanted to make sure that I was going to someone who had that expertise in the male anatomy.
It's so good, oh my God. This looks amazing. Even his neck's tighter than I thought it would be. All right, so we're gonna do, on this side is a little bit different anatomy. We're gonna come from here and do this area, go ahead. And that's the thing, so men, when I first moved to LA, you guys, I basically promoted myself doing two things that were different because I wanted to make sure I stood out. It was treating men and doing the gladiator high def lipo. Now we're gonna be calling that our Theraform procedure, but the that was what got me my patients. And I was talking to this patients yesterday. I thought we would see more, because we're in West Hollywood, more younger guys coming to me, but it turned out at that time, it was mainly elite professionals. They really wanted their face to always look good. They were nervous about getting treatment by anyone else that didn't know how to address a face. One more, turn it a little bit more. There we go, perfect. I don't want to go too wide. They were nervous about having their face, you know, messed up or looking unnatural. And so that's how it began. And years ago, no one wanted to do this. I would tell them to do it. I was ahead of my time. They'd be so freaked out. And I would say, do your lip or do an angle of your jaw. They wouldn't understand. And now it's what everyone really wants, you know? So let's look from the front. Look from the front, you guys, now. Take a look at that. That's incredible. That looks real good. Real good. So hold on. I'm just gonna wipe all this stuff. Okay. So we are just gonna keep building. Perfect. All right, let me let that sit a second. We'll go to the base of the chin and then. Okay, so I'm gonna start now in balancing this middle portion. So we just did all the width, and now we just gotta straighten it slightly. So typically on bone, or if someone had an implant, you could go here. And we're just creating that transition zone and the width in the tissue. Okay. And just building it out so he has a little more structure. He already has really good projection. It's more about evening it. Good. So question, so Jasmine, why don't you start asking us questions that people have, that they ask a lot, because that's stuff we need in our scripts, you know?
I mean, so,
What do people want to know with fillers?
so far.
No, not what they're asking now, just in general, so we have answers. Because if you script it out, what do you think people ask the most?
What happens after I get filler? Like,
You're gonna get swollen, you might get bruised, couple weeks, you guys, everyone always, like literally the next day people will write, I'm asymmetric or something. I'm like, I know, you're gonna be, because it's usually very swollen. I do a lot of needle pokes. I mean, obviously if there's pain, redness, or significant swelling and stuff like that, it's a different story. I would say then, there we go. Then you gotta call the doctor, make sure that there's no issue. But in general, you're going to be swollen, irregular, which is why we do red light, which is why we do CBD pills. I even have some people on peptides beforehand, or even a pill called KPB. We can put you guys on an oral medication that, where is it? An oral medicine that helps decrease inflammation. But asymmetry is normal, and sometimes I tell people it's going to take a few treatments. So now I'm going to do the fine wrinkle he has here. It's probably a little numb anyways, which is good because this hurts a little bit, but you see how I do these very superficial blebs, almost to the point where some of it comes out. I see. Get that wrinkle. This is very important technique. Oh, lost a little bit. I'm going to bring you another half. That's an expensive moisturizer, you guys. Grab me tell him bring me another half Veltero.
It's not
Or you
painful.
can
I don't even feel it.
No, you won't feel it. But it's HA, you guys, hyaluronic. There's an expensive version. But look how much the thing came down.
oh yeah.
But the reason why that happens is it's a very small space. Has a lot of pressure in a small needle. So sometimes they can pop. They're not meant to go very superficial. Now, here's the key, you guys. Not overdoing this, okay? He needs just a little. I want to give him structure, but I don't want to fill out him too much. I also don't want to look like a girl. He's got a lot of bone, so here we go. So you got to make it nice and like a little bit of enhancement. You guys will see. Okay.
I'm sure some people are wondering how long filler actually lasts.
Well, that's one of the questions. So this one is calcium hybrid, which will last about 12 to 18 months, maybe longer. But again, when you do the first treatment, you don't know how much you actually need. So a lot of times you're only doing a small amount. Hold right here just for 1 second with your right hand. Just hold. Yeah, there you go. And then I'm going to go to the other side. So 12 to 18 months, but on average, filler is about 9 to 12 months. Unless you're doing more long-term ones, like we're going to do a little bit to his mid-face under eye, where we do one that lasts him a little bit longer. It could be multiple years. Wow, you're gonna love it. You're gonna love it. But again, very small depot injections. Structure. Can you make sure they're doing the virtual? I want to do the Botox right afterwards and then virtual. You okay?
Mm-hmm.
You feel a little numbing. He's got a lot of veins.
The virtual right now?
Okay, hold right here now with your left hand.
Mm-hmm.
Perfect. Okay, tell him I'll be about 5 minutes.
It'll be like 5 minutes.
I'm coming
Is
back.
the Botox ready
Coming back. I
for
gotcha.
the next patient?
Do you take blood thinners or any vitamins?
Mm-mm.
I do just bleed easily. But I don't think you're gonna bruise.
Is the Botox ready?
So you guys see I'm doing these depot injections right on skin. This is how we treat acne scars with silicone, which is why I can do that really well. You guys see, look. It looks like there's no wrinkle there, huh? Anymore?
Yeah.
So
Can we
superficially.
make sure that the Botox is ready for the next patient?
I guess I'll do that right before. And then again, I'm just doing a little bit to blend his mouth corner. Because he has a little bit kind of like, not right there, not too much, but okay, hold here again.
Mm-hmm.
I'll come to the other side
Okay.
and let go. Go ahead. Beautiful. Good. Oh my gosh, you're gonna love it. And so blending this area, you guys, makes a big difference in the way a guy's face looks. Because look now, the structures. I think up close, you should take pictures of this and post that online because this is part of Maxurus, is this whole structure. Like, why is this now three-dimensionally so much better? Because we addressed it properly. Okay, cannula.
PJ, please make sure that the Botox patient is ready.
Okay,
In 5
now
minutes.
turn to the right. There you go. So we've created a little bit of this angle. You guys see right there, nothing too crazy. And now we're just gonna wash, okay? Right here. It's still gonna keep them sculpted, but it's gonna allow us, this is with a more permanent, it's not permanent, I guess, I would say a regenerative treatment. It's permanent, but it's fat injections. This is synthetic fat. There's only a couple versions of this on in the market right now. There's Renuva and there's Alloclay. Both we have. Renuva is good for these small, fine areas where we're just going to blend slightly and stimulate and balance it now from the cheek. This is going to help his under eye. But this is going to be more long-lasting and kind of regenerate his tissue. It's going to give him like a nicer, smooth transition. Okay? Again, because he's so lean, gotta be careful where we're going. It's gonna feel weird because there's a bunch of numbing, it's mixed. How this works. It's a powder that has growth factors and it gets mixed and kind of blended. So the way we inject it is in all these little threads. But you gotta get through the deeper tissue because this is fat, remember? We're keeping that triangular midface shape. There we go. Perfect. Okay, so hold on. And the other cannula. Massage it a little bit. Hold on. So I'm gonna massage that in. And look how much natural. There we go. Beautiful. Okay. So now I just want you to lightly hold here. Perfect. Okay. We'll go to the other side. Let that go. And clean for a second. And clean you.
So what can I not do after getting this?
That's a good question. So I don't like people to do massages, I would say, probably on their face. But most of the time I say you can go work out in 24 hours. Like there's not a lot you can't. I mean, I wouldn't go be running a marathon, something like that. But in general, I think, so this is all done. These are done. It's all done. Where's the cannula? The new cannula? Here. I would say in general, just take it easy, red light, do icing. I probably wouldn't do a steam room or a sauna today. Where's the needle for it? I wouldn't do a steam room or a sauna probably just because, turn a bit this way. So again, this triangular area right here is where guys tend to lose weight. He looks really good with it now because he's lean and young. But when he gets older, it would be hollow. So we're gonna do a little Renuva stimulation there, and it'll balance. We'll do it there plus the under eye. So you guys will see. It's gonna look a little crazy. I'm doing that from that far below, but sorry. There you go. Again, going all the way up into where we want regeneration. This is not filler per se. It just seeds the tissue and has the tissue produce, there we go, its own material. Okay.
Botox has been hyping you up on these comments.
Oh yeah?
He said
He's one of our promoters in Canada.
Yeah, he said he travels here from Vancouver. He said, I travel all the way from Vancouver to go see him. I don't bother going to anyone else. They always screw something up, LOL.
Yeah, we love Steven is one of our first Recodex transformations. He lost over 30 pounds on a peptide plan, and now he's getting asked out left and right on Instagram because he can't stop posting his selfies. So I told him, let us know how it goes because he looks so good. Sorry. You okay? There's a lot of weird movement. Okay.
It's okay.
There we go. So obviously we won't know how much this will do until until it blends in. But this creates a lifting effect, and a smoother transition. Now we're finally finishing up. And then the last thing is are always our favorite, all the girls' favorites for sure, the lips. Chin is amazing. Jawline back here, this side's a little weaker than the other, so I'm gonna just naturally that way. So I'm gonna give him a little bit more. And I'm gonna build out this posterior component that typically, I don't think people address this as much. We're gonna come up pre-auricular into the ear. That's gonna allow us to really create that 90-degree angle. There we go.
Many people on YouTube are asking what procedure.
Tell them.
This is the male sculpting treatment.
Maxorus, yes.
Maxorus treatment.
But male facial sculpting. And we do layered approach to sculpt the face. Bone structure, building out the foundation. I don't want too much in his cheek, but he had a little bit of a bruise, so I know it's not gonna be that high. So I'll put a little bit there, just to make sure that builds out properly. And then he's just gonna look real swollen right now on the middle face because of all the swelling. So when that goes down, he'll still be sculpted, but he'll have more of like a ridge here at the top that makes it look more like square. And then filling out the temples, I think that'd be another area for you to highlight on the before and after. So it's gonna be a big difference. The next couple of days is really where we're gonna see it the most. And then that is it. Okay, perfect. So now my favorite part, grab, you guys have ice? Yeah, grab a little bit of the ice. He probably won't feel this though. We're gonna clean him off. Hold on, I'll get you. Grab that, good. And we are gonna finish the sculpting part. Grab, yeah, just kiss that for a second. Just gonna blend, just massage. Perfect. Okay, go and let go. Now we do not want big lips on him, you guys. Not at all. I just want a little shape. So why then do his lips at all? Because he's gonna have a structured face. You don't want a structured face with no lip. So you gotta do something. So we're doing very little. It's like 0.2 per side, very small. Okay, sorry, I know. But we're gonna do a little bit on the pillars, very small. Okay, one more, hold on.
People keep asking what filler are you using now.
This is Volbella because it's extremely soft. This is like one of the ones I like the most for guys. Let me see the front. Oh yeah, look at that. How pretty. Okay, so guys, you don't need to do as many of the pillar approach, but I do want him to have some downward turn. Bring it down a little bit, so good. Go like that. And then we're also going to come across this side, straighten it out. Try and get some downward pull, sorry, on the lip. So the lips, his lips are small, we want some shaping. There we go. Okay, so I'm gonna go do the Botox, and then I'll come back and do the threads, and I'll do the she's gotta take pictures and everything before. All right, here we go. Hold on, one more.
Where are we going next? What room?
I gotta do the Botox. Yeah, and then I gotta do the
Where do you need Dr. Emer?
All right, so now let's show them. We're gonna do the Emer reveal. Wait 1 second and clean.
Testing, testing.
You're okay. Close your eyes. I gotcha.
I was good into the lips.
I know it's always this
What
one.
room is
It's the
Dr. Emer
hardest.
going to?
For the
Where's the Botox? What room? Parrish, do you know what room we're going to?
Why don't you go out there and figure out what's going on? I don't understand. All right, so now we're gonna do number reveal. I clean you off.
Alright.
All right, we're gonna have you lay back, hold that 45 degree. Yeah. Okay,
You
so
ready?
hold right there. Hold on, hold, no, grab it with your hands. Give it to him. Bring it 45 degrees. Okay, hold right there. That's perfect, actually. And now take a look, obviously with some swelling. What do you think?
Wow.
What do you think?
The jawline is amazing.
That's what you wanted, right?
Yeah.
So
the
you see how
jawline and
this
the
came up
chin.
so much?
Wow.
So what did you have before? Describe it.
I felt like it was more definitely a rounder face,
Mhm.
and definitely this is more defined, chiseled, like especially on the sides.
Yeah, this side is a little weaker than that side, so I do a lot more filler here. Actually, an entire syringe and a half more on that side. What do you think of the lips, actually?
The lips are good.
I love your
Yeah.
lips. I actually think it's almost the best. But one of the things we did was really structure through here, so it pulled this up more. Because with this, if this is coming down, that's all coming down. If there's structure here, it's lifting up. Your neck looks way better. Structured here, fill this out slightly. Again, there's some fluid there though, because that's the Renew, but it's gonna build up. Temples, a lot more filled and just blended, and it's just softer. This area here, what do you think?
No, it's perfect.
Way better. Like, yeah, you can build a structure on the bone, guys, but if you don't have that tissue, you don't get that pull. So we lift it up, I'll filler all the way up here, preauricular. And that's why it's the Maxiris procedure, because it's using these products that we have in a really different way. All right, so now if you take a look, his proportions are better, much straighter. Look how straight his nose is. You gotta have that chiseling here and there. You gotta have it perfect, right? All right, so do a little pan. Let them show his face. You do your pan. You can give him now. Take that back from him, and you do pan and show the face, and then we'll be back to finish.
All right.
Look up just a little, like right there. Perfect. Do a pan. You're good. I'll be back. Awesome. Congrats.